Good morning. This is Dr. Yogesh, HOD, Department of Physiology, Sri Chamundeshwari Medical College Hospital and Research Institute, Channapatna. Okay, let us continue with the next experiment. So today also we have our subject, Mr. Shivlingaya, our lab technician, who has agreed to help us to become a subject, and so that it becomes a easy learning for all of you, so that you can revise at your own time and at your own convenience. So for the sensory system, first thing what you should know is dermatome. What is a dermatome? And have a rough idea of the dermatomal map for the upper limb and at least the lower limb. Okay. So we are going to examine as per the dermatome only. Mainly we are going to see the upper limb. Sir, please remove it. And in all these examinations, same standard rule, always stand on the right side of the patient and take a consent. Any experiment, when a subject is involved, take a consent and proceed accordingly. Okay. So keep your hands on your side. Yes, yes, sir. So first we are going to start with the fine touch. So for the fine touch, you can use a wisp of cotton, or you can use the instrument one frame hair esthesiometer. In all this, for entire sensory system, you should know that because patient may not be aware of what kind of sense we are going to elicit. So ideally, first we have to show him this is how this sense you are going to feel. After that, we will ask the subject to close the eye and we are going to continue. Same rule. Bilaterally, we are going to check every dermatome. Okay. So I'll just make a wisp of cotton here. Okay. Sir, ಇದು ನೋಡಿ ಈ ತರ ಇರುತ್ತೆ ಗೊತ್ತಾ? Just ಗೊತ್ತಾಗುತ್ತಾ? ಮುಟ್ಟಿದ್ರೆ? Okay. ಈಗ ಕಣ್ಣು ಮುಚ್ಕೊಳ್ಳಿ. Whenever you feel this touch, please tell yes. Yes. Close your eyes, sir. So let us proceed.
Yes. 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 Yes.
Now can you feel?
No. Yes.
Okay, so that was a negative testing I did in between. Because patients are also extremely clever enough, they can know the interval of the stimuli. Okay, so now if you just observe, first I did all dermatome wise. I touched the tip of the thumb, different dermatome, then the tip of the middle finger, again different dermatome. I touched the tip of the little finger, again different dermatome. So like this, dermatome wise, check bilaterally. This is how we do the fine touch. Once you have checked this particular dermatome, no need to check again, because this dermatome, for example, the index finger, thumb, extending till here, it is all single dermatome it is. Once you have checked here, no need to check again, once again back up again. Okay. So this is for the fine touch. Next is the crude touch. For crude touch, you can just show the stimuli. Sir, it will be like this. Okay. Whenever you feel it, please tell me, sir. Okay. Close your eyes.
Yes. 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 Yes.
So this is for the crude touch. So let us proceed with the next one. So this instrument is the Weber's compass esthesiometer. Okay. So with this instrument, we are going to find out the 2-point discrimination. Okay. So you have the screw here. As you unscrew, you can see the blades are separating. So I will take it fully closer. So I am going to instruct him. Sir, please show me your hand. See, this is 1. ಎಷ್ಟು ಫೀಲ್ ಆಗುತ್ತೆ ಇದು 1 ಆಯ್ತು ಕಣ್ ತೆಗೀರಿ ಸರ್. Now, okay, so I am going to tell him whenever he feels 2, then he has to tell me. So I will start with the least distance first. Close your eyes, sir.
1,
concentrates a little more. Two. Okay. So once he says 2, I'll make a recording of how much it is. Same thing you are going to do on the opposite side also. Then tactile localization. For tactile localization, what are you going to do? Sir, open the eyes. Sir, wherever I touch with your opposite hand, you can open your eyes and you can touch and show where I touch. Okay. Now close your eyes. Open your eyes, sir. Open your eyes. Okay. So this is how we do tactile localization. In some books, they also give what is called discrimination distance. So when I touched somewhere here and he touched a little further away. So the distance between the actual point and the point where the patient is perceiving, that is called the discrimination distance. So this is tactile localization. We are done with 2-point discrimination. Next is the vibration sense. For this we use a tuning fork with 128 Hz frequency. Okay, so the tuning fork also, many of you do a mistake by holding the tuning fork and touching the blade. Okay, tuning fork we should handle always holding the stem. We should never touch the blade. Okay, and you just activate it and you can just show in once. So close your eyes. Okay, you can open your eyes, sir. Open your eyes. So you will feel like this. Okay. So now next we'll continue. So now close your eyes, sir. Can you feel? Okay. So this is a vibration sense. If you want to go one step a little more further, you can add another point. Here what will happen is, we have to tell the subject that once he stops feeling the vibration, immediately take and feel on yourself. If you continue to feel the vibration, and here we are assuming that we are normal, and we can have a rough estimation that in the subject vibration sense has slightly reduced. That also always we can compare and see. So always the tuning fork you should place on the bony prominences. Anywhere you can place it in the bony prominences. Next is this is the thermesthetiometer. Okay, this is used to check the temperature. It is marked here hot and cold. So it will be filled with hot water and cold water. Okay, so the subject we are going to ask him, sir, you should tell me is it hot or cold. Okay, so close your eyes, sir. So same thing I am going to do now. Okay, so whatever he is feeling, he is going to tell accordingly. The next one is this is the algometer. So for eliciting pain, there are two components: superficial pain and the deep pain. For superficial pain, you can use a pin and try to pick on the area of the dermatome. Okay. In the hospital side, always better to use disposable pins. Here also, it's good to use if you are having a disposable pin. And for deep pain, there are again two ways of doing it. One is trying to hold the muscle belly and squeeze it, or you squeeze the tendo Achilles for the deep pain. If you want to quantify the pain threshold, this is the device, the algometer. Okay, so there is a marking over here. Take it to 0 point on the mark, and what you have to do, you have to just go and press it. When he presses, when we should ask the patient when he has started to feel the pain to report immediately. As soon as he does, stop the experiment and just go see what is the reading over that. Okay. So next we have stereognosis. So for stereognosis, we give any of the commonly known objects. The patient will close the eye and try to identify it. So close your eyes. Okay. Can you see what it is?
Pen cap.
Okay. So he is able to, with his eyes closed, he is able to feel and tell what this is. Next is graphesthesia. For graphesthesia, sir, I am going to write something on your hand. Please try to tell what it is. Okay.
Yeah.
So I have written a letter. it is good to write whatever letter the patient or the subject understands. Okay, so with eyes closed also is able to identify what I have written. Okay, next is the proprioception. In proprioception, what we are going to do is, you can decide any joint, any particular joint. Okay, I am going to stabilize the joint, whichever I am going to check now, and I am going to tell the subject, sir, close your eyes. This is up and this is down. What is this?
Up,
Now,
up, down, up.
so I randomly do. Okay, so that is how we check for proprioception. In this, there is another step where in the opposite hand the person will show is it up or down. Shall we repeat it? So in that hand you can show is it up or down. Okay. See, he's showing it up. He's showing it as down. Okay. So these are the important all the headings. So you just see what is your question. A question may be to examine the anterolateral spinothalamic tract. So you have to know which are the sensations carried in the anterolateral and do only those. A question may be to test the dorsal column tract. So then you have to check all the sensations in the dorsal column tract. Okay, thank you.